Hello, aspiring healthcare professionals. Welcome back to the channel. If you're gearing up for the McQs-nclex exam, you know just how important it is to master pharmacology. And today, we're going to dive into 150 challenging multiple-choice questions to help you test and reinforce your pharmacology knowledge. Pharmacology can be a tough area to tackle, especially with all the drug classes, mechanisms of action, and interactions to remember. But don't worry, I've got you covered. By practicing these questions, you'll strengthen your understanding and boost your confidence as you prepare for the big exam. So, whether you're just starting your McQs-nclex prep or you're looking for ways to sharpen your skills, this video is packed with insights to help you succeed. Let's jump in and get one step closer to acing that McQs-nclex. 1. Which of the following is an example of a beta blocker? A. Lisinopril. B. Metoprolol. C. Losartan. D. Amlodipine. Answer: metoprolol. Rationale: metoprolol is a beta blocker used to manage hypertension and heart conditions. Lisinopril is an ACE inhibitor, losartan is an angiotensin II receptor blocker, and amlodipine is a calcium channel blocker. 2. What is the main action of diuretics in hypertension management? A. Increase blood volume. B. Dilate blood vessels. C. Decrease fluid volume by increasing urine output. D. Increase heart rate. Answer: decrease fluid volume by increasing urine output. Rationale: diuretics decrease blood pressure by removing excess sodium and fluid from the body, reducing blood volume. They do not affect blood vessel dilation or heart rate directly. 3. Which of the following drugs is contraindicated for use with potassium-sparing diuretics? A. Potassium chloride. B. Furosemide. C. Hydrochlorothiazide.
D. Digoxin.
Answer: potassium chloride. Rationale: potassium-sparing diuretics, such as spironolactone, increase potassium levels. Potassium chloride supplementation may lead to hyperkalemia, so it should be avoided. Furosemide and hydrochlorothiazide are not contraindicated with potassium-sparing diuretics. 4. A patient is prescribed digoxin. What is the priority assessment before administration? A. Heart rate. B. Respiratory rate. C. Blood pressure. D. Oxygen saturation. Answer: heart rate. Rationale: digoxin is a cardiac glycoside that affects heart rate and contractility. The nurse should check the heart rate before administration, as a rate lower than 60 beats per minute can indicate the need to withhold the medication. 5. Which of the following is a potential side effect of opioids? A. Diarrhea. B. Hypertension. C. Respiratory depression. D. Hyperglycemia. Answer: respiratory depression. Rationale: opioids, such as morphine, can depress the respiratory system, leading to slow or shallow breathing. Diarrhea, hypertension, and hyperglycemia are not common side effects of opioids. 6. Which of the following is a major side effect of ACE inhibitors? A. Constipation. B. Hyperkalemia. C. Hypoglycemia. D. Tachycardia. Answer: hyperkalemia. Rationale: ACE inhibitors such as enalapril can increase potassium levels, leading to hyperkalemia. Constipation is more common with opioids, hypoglycemia is a risk with insulin, and tachycardia is not a primary effect of ACE inhibitors. 7. What is the primary use of warfarin in a clinical setting? A. Hypertension. B. Deep vein thrombosis prevention. C. Asthma management. D. Pain relief. Answer: deep vein thrombosis prevention. Rationale: warfarin is an anticoagulant used to prevent blood clots, especially in conditions like deep vein thrombosis. It is not used for hypertension, asthma, or pain relief. 8. Which medication is commonly used for acute asthma exacerbations? A. Albuterol. B. Atenolol. C. Losartan. D. Furosemide. Answer: albuterol. Rationale: albuterol is a short-acting beta agonist used to relieve acute asthma symptoms. Atenolol is a beta blocker, losartan is an antihypertensive, and furosemide is a diuretic. 9. A nurse is administering morphine to a postoperative patient. What is the priority nursing assessment? A. Blood glucose level. B. Respiratory rate.
C. Bowel sounds.
D. Blood pressure. Answer: respiratory rate. Rational: opioids like morphine can cause respiratory depression, so monitoring the respiratory rate is critical. The other assessments are important, but respiratory rate takes priority. 10. Which of the following is a contraindication for the use of lithium in bipolar disorder? A. Renal disease. B. Asthma. C. Hypertension.
D. Diabetes.
Answer: renal disease. Rational: lithium is cleared by the kidneys, so it should not be used in patients with renal disease due to the risk of toxicity. Asthma, hypertension, and diabetes are not absolute contraindications for lithium use. 11. A patient is prescribed phenytoin for seizure control. What is a common side effect? A. Gingival hyperplasia.
B. Hair loss. C. Insomnia. D. Nausea.
Answer: gingival hyperplasia. Rational: phenytoin, an anticonvulsant, can cause gingival hyperplasia, gum overgrowth. Hair loss, insomnia, and nausea are not common side effects of phenytoin. 12. What is the primary function of insulin in the body? A. Regulate blood pressure. B. Stimulate red blood cell production. C. Lower blood glucose levels. D. Increase blood calcium levels. Answer: lower blood glucose levels. Rational: insulin is a hormone that helps regulate blood glucose levels by facilitating the uptake of glucose into cells. It does not regulate blood pressure, stimulate red blood cell production, or affect calcium levels. 13. A patient is taking prednisone for an autoimmune condition. What is a common side effect of long-term steroid use? A. Weight loss. B. Bone loss. C. Increased energy. D. Hypoglycemia. Answer: bone loss. Rational: long-term use of prednisone, a corticosteroid, can lead to bone loss and osteoporosis. Weight gain, increased energy, and hyperglycemia are more common side effects. 14. Which of the following medications is used for the treatment of tuberculosis, TB? A. Penicillin. B. Isoniazid.
C. Acetaminophen. D.
Ciprofloxacin. Answer: isoniazid. Rational: isoniazid is one of the first-line medications used to treat tuberculosis. Penicillin is an antibiotic for bacterial infections, acetaminophen is for pain and fever, and ciprofloxacin is a broad-spectrum antibiotic, but not typically used for TB. 15. A patient with diabetes is prescribed metformin. What is the most important nursing consideration when administering this drug? A. Monitor for signs of hypoglycemia. B. Assess liver function. C. Monitor blood pressure. D. Ensure adequate hydration. Answer: assess liver function. Rational: metformin is contraindicated in patients with liver disease due to the risk of lactic acidosis. Hypoglycemia is not a common side effect of metformin, and hydration and blood pressure monitoring are also important, but not the priority. 16. What is a common side effect of antihistamines, such as diphenhydramine Benadryl? A. Drowsiness. B. Insomnia. C. Diarrhea. D. Hypertension. Answer: drowsiness. Rational: antihistamines like diphenhydramine commonly cause drowsiness or sedation. They do not typically cause insomnia, diarrhea, or hypertension. 17. Which of the following medications is contraindicated in patients with glaucoma? A. Timolol. B. Diphenhydramine. C. Lisinopril.
D. Metformin.
Answer: diphenhydramine. Rational: diphenhydramine, an antihistamine, can increase intraocular pressure and is contraindicated in patients with glaucoma. Timolol is used to treat glaucoma, and lisinopril and metformin do not directly affect intraocular pressure. 18. A nurse is caring for a patient receiving heparin. What is the priority action to prevent bleeding complications? A. Monitor platelet count. B. Monitor liver function. C. Monitor for signs of bleeding. D. Monitor blood pressure. Answer. Monitor for signs of bleeding. Rational. Heparin is an anticoagulant, and monitoring for signs of bleeding is the priority to prevent complications. While platelet count and liver function are also important, bleeding is the primary concern with heparin. 19. What is the primary action of angiotensin-converting enzyme, ACE, inhibitors in hypertension management? A. Increase sodium excretion. B. Decrease blood volume. C. Dilate blood vessels. D. Increase heart rate. Answer. Dilate blood vessels. Rational. ACE inhibitors such as lisinopril work by inhibiting the conversion of angiotensin I to angiotensin II, leading to vasodilation, which reduces blood pressure. They do not directly affect sodium excretion, blood volume, or heart rate. 20. A patient is receiving gentamicin. What is the priority nursing assessment for this patient? A. Urine output. B. Blood glucose level. C. Oxygen saturation. D. Heart rate. Answer. Urine output. Rational. Gentamicin is an aminoglycoside that can cause nephrotoxicity. Monitoring urine output is essential to detect early signs of kidney damage. The other assessments are not directly related to gentamicin toxicity. 21. Which of the following medications can cause a serious adverse effect when taken with warfarin? A. Aspirin. B. Lisinopril. C. Metoprolol. D. Furosemide. Answer. Aspirin. Rational. Aspirin is an antiplatelet agent that can increase the risk of bleeding when taken with warfarin. Lisinopril, metoprolol, and furosemide do not significantly interact with warfarin in this way. 22. A patient is prescribed losartan. What is the primary concern during administration? A. Risk for hyperkalemia. B. Risk for dehydration. C. Risk for hypoglycemia. D. Risk for bradycardia. Answer. Risk for hyperkalemia. Rational. Losartan is an angiotensin II receptor blocker, ARB, that can increase potassium levels, leading to hyperkalemia. It does not typically cause dehydration, hypoglycemia, or bradycardia. 23. Which of the following medications should be used cautiously in patients with a history of seizures? A. Gabapentin. B. Furosemide. C. Clonazepam. D.
Bupropion.
Answer. Bupropion. Rational. Bupropion is associated with an increased risk of seizures, especially in patients with a history of seizures. Gabapentin, furosemide, and clonazepam do not pose the same risk. 24. Which of the following is a common side effect of statins like atorvastatin? A. Muscle pain. B. Weight gain. C. Insomnia. D. Increased appetite. Answer. Muscle pain. Rational. Statins, such as atorvastatin, can cause muscle pain and weakness as a side effect. Weight gain, insomnia, and increased appetite are not common side effects. 25. What is the primary action of beta blockers in the treatment of heart failure? A. Decrease heart rate. B. Increase blood pressure. C. Increase heart contractility. D. Dilate blood vessels. Answer. Decrease heart rate. Rational. Beta blockers like metoprolol decrease the heart rate and workload on the heart, improving symptoms in heart failure. They do not significantly affect blood pressure, contractility, or vessel dilation. 26. A patient is receiving ciprofloxacin for an infection. Which instruction should the nurse give to minimize the risk of tendon rupture? A. Drink plenty of fluids. B. Avoid high-impact exercises. C. Eat a high-protein diet. D. Take with food. Answer. Avoid high-impact exercises. Rational. Ciprofloxacin, a fluoroquinolone, can increase the risk of tendon rupture, especially in older adults. High-impact exercises should be avoided during treatment. The other instructions are not directly related to tendon rupture prevention. 27. What is the antidote for acetaminophen overdose?
A. Naloxone. B.
Acetylcysteine. C. Vitamin K, D. Activated charcoal. Answer. Acetylcysteine. Rational. Acetylcysteine is the antidote for acetaminophen overdose, as it helps to protect the liver. Naloxone is used for opioid overdose. Vitamin K is for warfarin overdose, and activated charcoal is used for certain types of poisoning, but not acetaminophen. 28. A patient is being treated with digoxin. Which of the following is the most serious potential side effect of this drug? A. Heart arrhythmias.
B. Diarrhea.
C. Constipation.
D. Fatigue.
Answer: heart arrhythmias. Rationale: digoxin can cause serious arrhythmias, especially if the serum levels are too high. Diarrhea, constipation, and fatigue are less common and less severe side effects. 29. What is a common side effect of diuretics like furosemide? A. Hyperkalemia. B. Hypertension. C. Hypokalemia. D. Hyperglycemia. Answer: hypokalemia. Rationale: furosemide is a loop diuretic that can lead to low potassium levels, hypokalemia. It is not associated with hyperkalemia, hypertension, or hyperglycemia. 30. A patient is taking amiodarone for arrhythmia. What is the primary concern during long-term use of this medication? A. Hypotension. B. Thyroid dysfunction. C. Liver toxicity. D. Visual disturbances. Answer: thyroid dysfunction. Rationale: amiodarone can cause thyroid dysfunction, either hypothyroidism or hyperthyroidism, due to its high iodine content. Monitoring thyroid function is crucial during long-term use. 31. What is the primary function of hydrochlorothiazide? A. Decrease blood pressure. B. Increase potassium levels. C. Treat heart failure. D. Increase blood glucose levels. Answer: decrease blood pressure. Rationale: hydrochlorothiazide is a thiazide diuretic used primarily to treat hypertension and heart failure by reducing blood volume and blood pressure. It does not directly increase potassium or blood glucose levels. 32. A patient is prescribed methotrexate for rheumatoid arthritis. What is a key nursing consideration? A. Monitor for signs of infection. B. Monitor potassium levels. C. Monitor for signs of dehydration. D. Monitor liver function. Answer: monitor for signs of infection. Rationale: methotrexate is an immunosuppressive drug that can increase the risk of infection. Liver function is important to monitor, but infection risk is more urgent. 33. Which of the following is a common side effect of opioid medications like morphine? A. Diarrhea. B. Constipation. C. Hyperactivity. D. Increased appetite. Answer: constipation. Rationale: opioids like morphine often cause constipation due to their effects on the gastrointestinal system. Diarrhea, hyperactivity, and increased appetite are less common side effects. 34. Which medication should be used cautiously in patients with asthma? A. Albuterol. B. Prednisone. C. Metoprolol. D. Furosemide. Answer: metoprolol. Rationale: beta blockers like metoprolol can cause bronchoconstriction and should be used cautiously in patients with asthma. Albuterol and prednisone are commonly used in asthma treatment. 35. A patient is receiving warfarin therapy. What should the nurse monitor closely? A. White blood cell count. B. Platelet count. C. International normalized ratio, INR. D. Blood glucose levels. Answer: international normalized ratio, INR. Rationale: warfarin is an anticoagulant, and the INR is monitored to ensure that the patient is within the therapeutic range and to prevent bleeding complications. 36. A patient with a history of peptic ulcer disease is prescribed ibuprofen. What is the primary concern? A. Risk for GI bleeding. B. Risk for kidney damage. C. Risk for hypotension. D. Risk for hyperglycemia. Answer: risk for GI bleeding. Rationale: nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen can irritate the stomach lining and increase the risk of gastrointestinal bleeding, especially in patients with a history of peptic ulcers. 37. A patient is taking atorvastatin for hyperlipidemia. What is a common side effect of this drug? A. Muscle pain.
B. Diarrhea.
C. Hypertension. D. Drowsiness. Answer: muscle pain. Rational: a common side effect of statins, such as atorvastatin, is muscle pain myopathy. Diarrhea, hypertension, and drowsiness are not typical side effects. 38. Which of the following is a contraindication for the use of beta blockers? A. Asthma. B. Hypertension. C. Heart failure. D. Hyperlipidemia. Answer: asthma. Rational: beta blockers can cause bronchoconstriction and should be used with caution or avoided in patients with asthma. They are commonly used to treat hypertension and heart failure. 39. A patient with heart failure is prescribed spironolactone. What is the primary concern? A. Risk for hyperkalemia. B. Risk for hypokalemia. C. Risk for dehydration. D. Risk for constipation. Answer: risk for hyperkalemia. Rational: spironolactone is a potassium-sparing diuretic, which can lead to hyperkalemia. Monitoring potassium levels is essential to prevent this complication. 40. A patient is prescribed levothyroxine for hypothyroidism. What is a key nursing consideration? A. Take the medication with food. B. Monitor for signs of hyperthyroidism. C. Avoid grapefruit juice. D. Monitor blood glucose levels. Answer: monitor for signs of hyperthyroidism. Rational: levothyroxine is used to treat hypothyroidism, and too much can cause symptoms of hyperthyroidism. It should be taken on an empty stomach, not with food or grapefruit juice. 41. A patient is prescribed furosemide. Which of the following should the nurse monitor closely? A. Serum sodium levels. B. Serum potassium levels. C. Serum calcium levels. D. Blood pressure. Answer: serum potassium levels. Rational: furosemide is a loop diuretic that can cause significant potassium loss, leading to hypokalemia. Serum potassium levels should be closely monitored. 42. A patient is taking digoxin for atrial fibrillation. What is the primary nursing consideration? A. Monitor for signs of bradycardia. B. Monitor blood pressure. C. Monitor for signs of hyperkalemia. D. Monitor liver function. Answer: monitor for signs of bradycardia. Rational: digoxin can cause bradycardia, so the nurse should monitor the patient's heart rate. Liver function is important to monitor in some medications, but bradycardia is a key concern with digoxin. 43. A patient with chronic pain is prescribed tramadol. What is a common side effect of this medication? A. Sedation. B. Weight gain. C. Hypertension. D. Diarrhea. Answer: sedation. Rational: tramadol is an opioid-like medication that can cause sedation and drowsiness. Weight gain, hypertension, and diarrhea are not common side effects. 44. Which of the following drugs is commonly used to treat acute bacterial infections? A. Furosemide. B. Ciprofloxacin. C. Warfarin. D. Metformin. Answer: ciprofloxacin. Rational: ciprofloxacin is an antibiotic used to treat various bacterial infections. Furosemide is a diuretic, warfarin is an anticoagulant, and metformin is used for diabetes management. 45. A patient is prescribed nitroglycerin for chest pain. What is a common side effect of this medication? A. Headache. B. Tachycardia. C. Constipation. D. Insomnia. Answer: headache. Rational: nitroglycerin, a vasodilator, can cause headaches due to the dilation of blood vessels. Tachycardia, constipation, and insomnia are less common side effects. 46. A patient is receiving high-dose corticosteroid therapy. What is a common complication of long-term steroid use? A. Osteoporosis. B. Hyperglycemia. C. Hypokalemia. D. Hypertension. Answer: osteoporosis. Rational: long-term corticosteroid use can lead to osteoporosis by affecting calcium and bone metabolism. Hyperglycemia and hypertension can also occur, but osteoporosis is a major concern. 47. Which of the following is a common side effect of calcium channel blockers? A. Dizziness. B. Weight loss. C. Constipation. D. Tachycardia. Answer: constipation. Rational: calcium channel blockers can cause constipation due to their effect on smooth muscle in the gastrointestinal tract. Dizziness, weight loss, and tachycardia are less common side effects. 48. A patient is prescribed clopidogrel. What is the primary action of this medication? A. Reduce cholesterol levels. B. Prevent blood clots. C. Lower blood pressure. D. Treat infection. Answer: prevent blood clots. Rational: clopidogrel is an antiplatelet medication that prevents blood clots. It does not reduce cholesterol, lower blood pressure, or treat infection. 49. A patient with diabetes is prescribed glipizide. What is the mechanism of action of this medication? A. Increase insulin sensitivity. B. Stimulate insulin release. C. Decrease glucose production in the liver. D. Slow carbohydrate absorption. Answer: stimulate insulin release. Rational: glipizide is a sulfonylurea that stimulates the pancreas to release insulin. It does not affect insulin sensitivity, liver glucose production, or carbohydrate absorption directly. 50. A patient is receiving heparin therapy. What laboratory test should be monitored to assess the therapeutic effect? A. Prothrombin time, PT. B. International Normalized Ratio, INR. C. Activated Partial Thromboplastin Time, APTT. D. Platelet count. Answer: Activated Partial Thromboplastin Time, APTT. Rational: heparin therapy is monitored by measuring the APTT to ensure that the patient is within the therapeutic range. PT, INR, and platelet count are used to monitor other anticoagulants and conditions. 51. Which of the following medications is classified as a proton pump inhibitor, PPI? A. Omeprazole. B. Ranitidine. C. Sucralfate. D. Lansoprazole. Answer: omeprazole. Rational: proton pump inhibitors, PPIs, inhibit gastric acid production by blocking the proton pump in the stomach lining. Omeprazole is a PPI used to treat conditions like GERD and ulcers. Ranitidine is an H2 blocker, sucralfate is a mucosal protectant, and lansoprazole is also a PPI, but omeprazole is more commonly used. 52. What is the primary therapeutic effect of morphine? A. Analgesia. B. Antipyretic. C. Antihypertensive. D. Antidiarrheal. Answer: analgesia. Rational: morphine is an opioid analgesic that works by binding to opioid receptors in the brain and spinal cord to relieve pain. It does not have antipyretic, antihypertensive, or antidiarrheal properties. 53. Which class of drugs is most commonly used to treat hypertension by inhibiting the angiotensin-converting enzyme, ACE? A. ACE inhibitors. B. Beta blockers. C. Calcium channel blockers. D. Diuretics. Answer: ACE inhibitors. Rational: ACE inhibitors such as enalapril inhibit the conversion of angiotensin I to angiotensin II, helping to lower blood pressure. Beta blockers, calcium channel blockers, and diuretics work in different mechanisms to control hypertension. 54. Which of the following is a common side effect of corticosteroid therapy? A. Hyperglycemia. B. Hypotension. C. Bradycardia. D. Hypokalemia. Answer: hyperglycemia. Rational: corticosteroids such as prednisone can increase blood sugar levels, leading to hyperglycemia. Other side effects may include hypertension, tachycardia, and hypokalemia, but hyperglycemia is the most common. 55. What is the mechanism of action of warfarin? A. Inhibition of vitamin K-dependent clotting factors. B. Inhibition of platelet aggregation. C. Inhibition of thrombin formation. D. Activation of antithrombin 3. Answer: inhibition of vitamin K-dependent clotting factors. Rational: warfarin works by inhibiting the action of vitamin K, which is necessary for synthesizing clotting factors 2, 7, 9, and X. This prevents the formation of blood clots. Other options describe the actions of different anticoagulants or antiplatelet drugs. 56. Which of the following medications is contraindicated in a patient with a history of peptic ulcers? A. Ibuprofen. B. Paracetamol. C. Acetaminophen. D. Diphenhydramine. Answer: ibuprofen. Rational. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can increase the risk of bleeding and irritation in the stomach, worsening peptic ulcers. Paracetamol and acetaminophen are not irritating to the stomach lining, and diphenhydramine is an antihistamine. 57. Which of the following drugs is classified as a selective serotonin reuptake inhibitor, SSRI? A. Fluoxetine. B. Amitriptyline. C. Clonazepam. D. Haloperidol. Answer: fluoxetine. Rational. Fluoxetine is an SSRI used to treat depression, anxiety, and other mood disorders. Amitriptyline is a tricyclic antidepressant, clonazepam is a benzodiazepine, and haloperidol is an antipsychotic. 58. What is the primary purpose of administering naloxone Narcan to a patient? A. Reverse opioid overdose. B. Relieve anxiety. C. Treat alcohol withdrawal. D. Reduce blood pressure. Answer: reverse opioid overdose. Rational. Naloxone is an opioid antagonist that rapidly reverses the effects of opioid overdose, such as respiratory depression and sedation. It is not used to treat anxiety, alcohol withdrawal, or hypertension. 59. A patient is prescribed levothyroxine for hypothyroidism. When should the nurse instruct the patient to take the medication? A. With food. B. In the evening. C. In the morning on an empty stomach. D. After a meal. Answer: in the morning on an empty stomach. Rational. Levothyroxine should be taken in the morning, at least 30 to 60 minutes before eating, to ensure optimal absorption. Taking it with food or after meals may reduce its effectiveness. 60. A nurse is preparing to administer digoxin. Which of the following is a priority action before giving this medication? A. Check the heart rate. B. Check the blood pressure. C. Assess respiratory rate. D. Measure blood glucose. Answer: check the heart rate. Rational. Before administering digoxin, a nurse should assess the heart rate. If the heart rate is below 60 bpm in adults, the dose should be withheld and the healthcare provider notified, as digoxin can slow the heart rate. 61. Which of the following medications is commonly prescribed to treat high cholesterol levels? A. Metformin. B. Atorvastatin. C. Hydrocodone. D. Furosemide. Answer: atorvastatin. Rational. Atorvastatin is a statin used to lower cholesterol levels by inhibiting the enzyme HMG-CoA reductase. Metformin is used for diabetes, hydrocodone is an opioid pain medication, and furosemide is a diuretic. 62. A nurse is administering a dose of insulin to a patient. Which of the following actions is correct? A. Administer the insulin injection into the muscle. B. Rotate injection sites to avoid lipohypertrophy. C. Inject insulin into the abdominal muscle for faster absorption. D. Warm insulin before injection to prevent pain. Answer: rotate injection sites to avoid lipohypertrophy. Rational. Rotating injection sites is recommended to avoid the development of lipohypertrophy, which can affect absorption. Insulin should be injected subcutaneously, not into muscles, and warming insulin is not necessary. 63. Which of the following side effects is most commonly associated with the use of antibiotics like amoxicillin? A. Hypertension. B. Diarrhea. C. Insomnia. D. Tachycardia. Answer: diarrhea. Rational. Antibiotics like amoxicillin can disrupt the normal flora in the intestines, leading to diarrhea. Other side effects, such as hypertension, insomnia, and tachycardia, are not typical for amoxicillin. 64. Which of the following is a contraindication for the use of tetracycline antibiotics? A. Pregnancy. B. Hypertension. C. Asthma. D. Anemia. Answer: pregnancy. Rational. Tetracyclines, including doxycycline, are contraindicated during pregnancy due to their potential to affect fetal bone and tooth development. They are not contraindicated in hypertension, asthma, or anemia. 65. Which class of drugs is used to treat asthma by relaxing the muscles around the airways? A. Beta blockers. B. Corticosteroids. C. Bronchodilators. D. Antibiotics. Answer: bronchodilators. Rational. Bronchodilators, such as albuterol, work by relaxing the smooth muscles around the airways, helping to open them and make breathing easier. Corticosteroids reduce inflammation, but they don't relax airway muscles. 66. What is the primary mechanism of action of aspirin? A. Inhibits COX enzymes to reduce inflammation and pain. B. Increases dopamine levels in the brain. C. Blocks histamine receptors to reduce allergic reactions. D. Stimulates the release of serotonin. Answer. Inhibits COX enzymes to reduce inflammation and pain. Rational. Aspirin works by inhibiting cyclooxygenase, COX, enzymes, which are involved in the production of prostaglandins that cause inflammation and pain. It does not affect dopamine, histamine, or serotonin. 67. A nurse is preparing to administer a beta blocker to a patient with hypertension. Which of the following vital signs should be checked before administration? A. Respiratory rate. B. Heart rate. C. Blood pressure. D. Oxygen saturation. Answer. Heart rate. Rational. Beta blockers slow the heart rate, so it is essential to check the heart rate before administration. If the heart rate is below 60 bpm, the medication may need to be withheld. Blood pressure should also be monitored, but heart rate is the priority. 68. Which of the following medications is used to treat hyperthyroidism by inhibiting thyroid hormone production? A. Levothyroxine. B. Methimazole. C. Insulin. D. Prednisone. Answer. Methimazole. Rational. Methimazole is an antithyroid medication that inhibits the synthesis of thyroid hormones used to treat hyperthyroidism. Levothyroxine is used to treat hypothyroidism, insulin is for diabetes, and prednisone is a corticosteroid. 69. What is the primary action of calcium channel blockers in the treatment of hypertension? A. Increase calcium influx into the heart. B. Block calcium influx into smooth muscle cells. C. Dilate blood vessels in the brain. D. Stimulate the release of norepinephrine. Answer. Block calcium influx into smooth muscle cells. Rational. Calcium channel blockers, such as amlodipine, relax and dilate blood vessels by inhibiting calcium from entering smooth muscle cells, which lowers blood pressure. They do not stimulate norepinephrine or affect calcium influx in the heart. 70. Which of the following is a common side effect of opioid analgesics such as morphine? A. Diarrhea. B. Constipation. C. Hypertension. D. Tachypnea. Answer. Constipation. Rational. Opioids like morphine often cause constipation by decreasing gastrointestinal motility. Diarrhea, hypertension, and tachypnea are not common side effects of opioids. 71. Which of the following drugs can interact with warfarin and increase the risk of bleeding? A. Vitamin K. B. Aspirin. C. Acetaminophen. D. Calcium supplements. Answer. Aspirin. Rational. Aspirin is an anticoagulant that can increase the risk of bleeding when taken with warfarin. Vitamin K, acetaminophen, and calcium supplements do not have the same effect. 72. A patient is receiving a diuretic for hypertension. Which of the following side effects should the nurse monitor for? A. Hyperkalemia. B. Hypokalemia. C. Hyperglycemia. D. Hypercalcemia. Answer. Hypokalemia. Rational. Diuretics, particularly loop diuretics, can lead to the loss of potassium in the urine, causing hypokalemia. Hyperkalemia, hyperglycemia, and hypercalcemia are not typically caused by diuretics. 73. Which of the following medications is used to treat an acute asthma attack? A. Salmeterol. B. Montelukast. C. Albuterol. D. Fluticasone. Answer. Albuterol. Rational. Albuterol is a short-acting beta agonist that provides quick relief for acute asthma attacks by relaxing airway muscles. Salmeterol is a long-acting beta agonist, Montelukast is a leukotriene receptor antagonist, and fluticasone is an inhaled corticosteroid. 74. Which of the following is a common side effect of benzodiazepines, such as lorazepam? A. Sedation. B. Weight loss. C. Tachycardia. D. Hypotension. Answer. Sedation. Rational. Benzodiazepines like lorazepam are central nervous system depressants that commonly cause sedation and drowsiness. They do not typically cause weight loss, tachycardia, or hypotension. 75. A nurse is administering a dose of furosemide to a patient with heart failure. Which of the following lab values should be checked prior to administration? A. Potassium B, calcium C, sodium D, magnesium. Answer: potassium. Rational. Furosemide is a loop diuretic that can cause significant potassium loss. The nurse should check the potassium level before administration to prevent hypokalemia, which can lead to serious complications. 76. A nurse is caring for a patient receiving lithium for bipolar disorder. Which of the following is a sign of lithium toxicity? A. Tremors. B. Bradycardia. C. Hyperglycemia. D. Increased appetite. Answer: tremors. Rational. Tremors are a common sign of lithium toxicity. Other signs include nausea, vomiting, and confusion. Bradycardia, hyperglycemia, and increased appetite are not indicative of lithium toxicity. 77. Which of the following is the first-line treatment for anaphylaxis? A. Epinephrine. B. Diphenhydramine. C. Prednisone. D. Albuterol. Answer: epinephrine. Rational. Epinephrine is the first-line treatment for anaphylaxis as it rapidly reverses symptoms by constricting blood vessels and relaxing airway muscles. Diphenhydramine and prednisone can help with symptoms but are not as effective for emergency treatment. 78. What is the primary action of statin medications? A. Inhibit cholesterol synthesis. B. Increase HDL levels. C. Block beta receptors. D. Dilate blood vessels. Answer: inhibit cholesterol synthesis. Rational. Statins, such as atorvastatin, work by inhibiting the enzyme HMG-CoA reductase, which plays a key role in cholesterol synthesis. They do not increase HDL levels or dilate blood vessels directly. 79. A patient is prescribed clopidogrel after a myocardial infarction. Which of the following is the primary action of clopidogrel? A. Inhibit platelet aggregation. B. Increase clotting factor production. C. Inhibit thrombin activity. D. Increase red blood cell production. Answer: inhibit platelet aggregation. Rational. Clopidogrel is an antiplatelet medication that prevents platelets from sticking together, reducing the risk of clot formation. It does not affect clotting factors, thrombin, or red blood cell production. 80. Which of the following is a common adverse effect of corticosteroids like prednisone? A. Weight loss. B. Hyperglycemia. C. Hypotension. D. Hypokalemia. Answer: hyperglycemia. Rational. Corticosteroids like prednisone can increase blood sugar levels, leading to hyperglycemia. They typically cause weight gain, not weight loss, and may lead to hypertension rather than hypotension. 81. A nurse is preparing to administer digoxin to a patient. Which of the following symptoms indicates a potential digoxin toxicity? A. Nausea and vomiting. B. Chest pain. C. Hypotension. D. Fever. Answer: nausea and vomiting. Rational. Symptoms of digoxin toxicity include nausea, vomiting, confusion, and visual disturbances. Chest pain, hypotension, and fever are not typical symptoms of digoxin toxicity. 82. Which of the following medications is used to treat peptic ulcers by reducing stomach acid production? A. Omeprazole. B. Metformin. C. Prednisone. D. Lisinopril. Answer: omeprazole. Rational. Omeprazole is a proton pump inhibitor, PPI, that reduces stomach acid production, helping to heal peptic ulcers. Metformin is used for diabetes. Prednisone is a corticosteroid, and lisinopril is an ACE inhibitor for hypertension. 83. A nurse is caring for a patient receiving vancomycin. Which of the following is the most important to monitor during treatment? A. Liver function tests. B. Renal function tests. C. Cardiac enzyme levels. D. Blood glucose levels. Answer: renal function tests. Rational. Vancomycin is nephrotoxic, so monitoring renal function, creatinine, and BUN levels is crucial to detect potential kidney damage. It does not commonly affect liver function, cardiac enzymes, or blood glucose. 84. A nurse is caring for a patient with diabetes who is prescribed metformin. Which of the following should the nurse monitor for as a potential side effect? A. Hypoglycemia. B. Hyperkalemia. C. Lactic acidosis. D. Hypernatremia. Answer: lactic acidosis. Rational. Metformin can lead to lactic acidosis, a rare but serious side effect. Hypoglycemia is not typically a concern with metformin, and it does not commonly affect potassium or sodium levels. 85. Which of the following medications is used to treat fungal infections? A. Fluconazole. B. Amoxicillin. C. Metronidazole. D. Vancomycin. Answer: fluconazole. Rationale: fluconazole is an antifungal medication used to treat fungal infections. Amoxicillin is an antibiotic for bacterial infections. Metronidazole is used for anaerobic bacterial infections, and vancomycin is used for severe bacterial infections. 86. What is the primary action of proton pump inhibitors, PPIs, in the treatment of gastroesophageal reflux disease, GERD? A. Decrease gastric acid production. B. Neutralize stomach acid. C. Increase esophageal sphincter tone. D. Promote mucosal healing. Answer: decrease gastric acid production. Rationale: PPIs like omeprazole decrease gastric acid production by inhibiting the proton pump in the stomach lining, helping to treat GERD. They do not neutralize acid or directly affect the esophageal sphincter tone. 87. Which of the following medications is used to prevent blood clots after a hip replacement surgery? A. Heparin. B. Levothyroxine. C. Propranolol. D. Metformin. Answer: heparin. Rationale: heparin is an anticoagulant used to prevent blood clots in patients undergoing surgery, such as hip replacement. Levothyroxine is for hypothyroidism, propranolol is a beta blocker, and metformin is for diabetes. 88. A patient is prescribed warfarin. Which of the following is essential for the nurse to monitor? A. Serum albumin levels. B. International normalized ratio, INR. C. Platelet count. D. Creatinine levels. Answer: international normalized ratio, INR. Rationale: warfarin is an anticoagulant, and the INR is used to monitor the effectiveness of the drug and prevent bleeding complications. Monitoring albumin, platelet count, and creatinine is not as critical as INR for warfarin therapy. 89. A nurse is caring for a patient receiving anticoagulant therapy with enoxaparin. Which of the following is an important nursing intervention? A. Monitor for signs of bleeding. B. Assess lung sounds for crackles. C. Monitor liver function tests. D. Check blood glucose levels. Answer: monitor for signs of bleeding. Rationale: enoxaparin is a low molecular weight heparin, and bleeding is a primary concern. Monitoring lung sounds, liver function, and blood glucose are not as critical with this medication. 90. Which of the following medications is used to treat anxiety? A. Diazepam. B. Propranolol. C. Lisinopril. D. Hydrocodone. Answer: diazepam. Rationale: diazepam is a benzodiazepine used to treat anxiety by calming the central nervous system. Propranolol is a beta blocker for hypertension, lisinopril is an ACE inhibitor, and hydrocodone is an opioid pain medication. 91. Which of the following medications is used to treat asthma by reducing inflammation? A. Albuterol. B. Montelukast. C. Insulin. D. Lisinopril. Answer: Montelukast. Rationale: Montelukast is a leukotriene receptor antagonist used to reduce inflammation in asthma. Albuterol is a bronchodilator. Insulin is used for diabetes, and lisinopril is an ACE inhibitor for hypertension. 92. A nurse is caring for a patient receiving warfarin. Which laboratory test should be monitored? A. Platelet count. B. INR. C. Creatinine. D. Sodium level. Answer: INR. Rationale: warfarin therapy requires monitoring the international normalized ratio, INR, to assess the blood's clotting ability. Platelet count is monitored for other conditions, and creatinine and sodium levels are unrelated to warfarin therapy. 93. Which of the following medications is used to reverse the effects of opioid overdose? A. Naloxone. B. Digoxin. C. Acetaminophen. D. Lorazepam. Answer: naloxone. Rationale: naloxone is an opioid antagonist used to reverse opioid overdose. Digoxin is for heart failure, acetaminophen is a pain reliever, and lorazepam is an anxiolytic. 94. A patient on digoxin therapy presents with nausea and visual disturbances. What should the nurse assess for? A. Hypokalemia. B. Hyperglycemia. C. Hyperkalemia. D. Hypoglycemia. Answer: hypokalemia. Rationale: Hypokalemia can increase the risk of digoxin toxicity, which presents with nausea and visual disturbances. Hyperglycemia, hyperkalemia, and hypoglycemia are not typically associated with digoxin toxicity. 95. Which of the following is a common side effect of opioids? A. Diarrhea. B. Hypertension. C. Constipation. D. Insomnia. Answer: constipation. Rational. Opioids commonly cause constipation by slowing bowel motility. Diarrhea, hypertension, and insomnia are not typical side effects of opioids. 96. A nurse is administering furosemide to a patient. Which of the following should be monitored closely? A. Potassium levels. B. Calcium levels. C. Sodium levels. D. Glucose levels. Answer: potassium levels. Rational. Furosemide is a loop diuretic that can cause potassium loss, leading to hypokalemia. Calcium, sodium, and glucose levels are not the primary concern with furosemide use. 97. Which of the following medications is used to treat anaphylaxis? A. Epinephrine. B. Morphine. C. Metformin. D. Acetaminophen. Answer: epinephrine. Rational. Epinephrine is the first-line treatment for anaphylaxis, as it reverses airway constriction and hypotension. Morphine is for pain, metformin is for diabetes, and acetaminophen is for fever or pain. 98. A nurse is caring for a patient who is taking prednisone. What is a common side effect of long-term prednisone therapy? A. Weight loss. B. Hypertension. C. Hypoglycemia. D. Bone thinning. Answer: bone thinning. Rational. Long-term prednisone use can cause bone thinning and osteoporosis. Weight gain, hypertension, and hyperglycemia are more commonly associated with prednisone rather than weight loss or hypoglycemia. 99. Which of the following medications is commonly prescribed to lower cholesterol levels? A. Atorvastatin. B. Lorazepam. C. Prednisone. D. Lisinopril. Answer: atorvastatin. Rational. Atorvastatin is a statin used to lower cholesterol. Lorazepam is an anxiolytic, prednisone is a corticosteroid, and lisinopril is an ACE inhibitor for hypertension. 100. A nurse is administering an antihypertensive medication to a patient. Which of the following should be monitored? A. Blood pressure. B. Potassium levels. C. Glucose levels. D. Calcium levels. Answer: blood pressure. Rational. Blood pressure should be closely monitored when administering antihypertensive medications to assess their effectiveness. Potassium, glucose, and calcium levels may need monitoring depending on the specific medication used, but are not the primary concern. 101. A patient on a high-dose steroid regimen for an autoimmune disease is at risk for which of the following complications? A. Osteoporosis. B. Hyperthyroidism. C. Hypoglycemia. D. Hyperkalemia. Answer: osteoporosis. Rational. Long-term steroid use increases the risk of osteoporosis due to reduced calcium absorption and bone density loss. Hyperthyroidism, hypoglycemia, and hyperkalemia are not directly related to steroid use. 102. A patient is prescribed ciprofloxacin for a urinary tract infection. Which of the following should the nurse educate the patient about? A. Avoiding sunlight exposure. B. Taking it with milk. C. Increasing dietary sodium. D. Reducing fluid intake. Answer: avoiding sunlight exposure. Rational. Ciprofloxacin is a fluoroquinolone that can increase sensitivity to sunlight, leading to sunburn. It should not be taken with milk or involve changes to fluid or sodium intake. 103. A nurse is caring for a patient receiving a beta blocker. What should the nurse monitor for? A. Heart rate. B. Blood sugar. C. Urine output. D. Respiratory rate. Answer: heart rate. Rational. Beta blockers decrease heart rate and blood pressure. Monitoring heart rate is essential to avoid bradycardia. Blood sugar, urine output, and respiratory rate are not the primary monitoring concerns with beta blockers. 104. A patient is receiving morphine for pain management. What is the primary concern during assessment? A. Respiratory depression. B. Dehydration. C. Hypertension. D. Nausea. Answer: respiratory depression. Rational. Morphine can cause respiratory depression, which is a primary concern in opioid administration. Dehydration, hypertension, and nausea are side effects, but are not as immediately critical as respiratory depression. 105. A nurse is preparing to administer insulin to a diabetic patient. Which of the following should the nurse check before administration? A. Blood glucose level. B. Blood pressure. C. Electrolyte levels. D. Weight. Answer: blood glucose level. Rational: insulin dosage should be based on the patient's blood glucose level to ensure appropriate administration. Blood pressure, electrolyte levels, and weight are not the primary factors influencing insulin administration. 106. Which of the following is a common side effect of statin medications? A. Muscle pain. B. Nausea. C. Insomnia. D. Hair loss. Answer: muscle pain. Rational: statins can cause muscle pain or myopathy as a side effect, particularly at high doses. Nausea, insomnia, and hair loss are less commonly associated with statin use. 107. A patient is prescribed captopril for hypertension. Which of the following should the nurse monitor for? A. Angioedema. B. Hypokalemia. C. Hyperglycemia. D. Hypertension. Answer: angioedema. Rational: angioedema is a serious adverse effect of ACE inhibitors like captopril. Hypokalemia, hyperglycemia, and hypertension are not common side effects of ACE inhibitors. 108. A nurse is caring for a patient on warfarin therapy. Which food should the patient limit while on warfarin? A. Leafy green vegetables. B. Citrus fruits. C. Dairy products. D. Salted snacks. Answer: leafy green vegetables. Rational: leafy green vegetables are high in vitamin K, which can interfere with warfarin's anticoagulant effect. Citrus fruits, dairy products, and salted snacks do not significantly affect warfarin therapy. 109. Which of the following medications is used to treat anxiety? A. Diazepam. B. Metformin. C. Lorazepam. D. Atorvastatin. Answer: diazepam. Rational: diazepam and lorazepam are benzodiazepines used to treat anxiety. Metformin is for diabetes, and atorvastatin is for cholesterol management. 110. A nurse is administering an antibiotic to a patient with a bacterial infection. Which of the following is a common side effect of antibiotics? A. Diarrhea. B. Weight gain. C. Hyperglycemia. D. Bradycardia. Answer: diarrhea. Rational: diarrhea is a common side effect of antibiotics due to their effect on gut flora. Weight gain, hyperglycemia, and bradycardia are not typically associated with antibiotics. 111. A nurse is caring for a patient receiving a calcium channel blocker. Which of the following is a common side effect? A. Dizziness. B. Constipation. C. Rash. D. Insomnia. Answer: dizziness. Rational: calcium channel blockers can cause dizziness as a common side effect due to their blood pressure lowering effect. Constipation, rash, and insomnia are less common. 112. Which of the following medications is used to treat hyperthyroidism? A. Levothyroxine. B. Methimazole. C. Insulin. D. Prednisone. Answer: methimazole. Rational: methimazole is an antithyroid medication used to treat hyperthyroidism. Levothyroxine is used for hypothyroidism, and insulin and prednisone are unrelated to thyroid function. 113. A nurse is caring for a patient who is prescribed an SSRI. Which of the following is a common side effect? A. Increased appetite. B. Insomnia. C. Nausea. D. Dry mouth. Answer: nausea. Rational: nausea is a common side effect of SSRIs, selective serotonin reuptake inhibitors, in the initial stages of treatment. Increased appetite, insomnia, and dry mouth are less commonly reported. 114. A patient is prescribed atorvastatin. Which of the following should the nurse monitor for? A. Liver function. B. Blood glucose levels. C. Potassium levels. D. Renal function. Answer: liver function. Rational: statins like atorvastatin can affect liver function, so liver enzymes should be monitored. Blood glucose, potassium, and renal function are not the primary concerns with statin therapy. 115. A nurse is caring for a patient on a diuretic. Which of the following should the nurse monitor closely? A. Blood pressure. B. Heart rate. C. Electrolyte levels. D. Blood glucose. Answer: Electrolyte levels. Rational. Diuretics can cause imbalances in electrolytes, especially potassium. Blood pressure and heart rate are also monitored, but are secondary to electrolyte levels. Blood glucose is not typically affected. 116. Which of the following medications is a common treatment for hypertension? A. Metoprolol. B. Furosemide. C. Diphenhydramine. D. Prednisone. Answer: metoprolol. Rational. Metoprolol is a beta blocker used to treat hypertension. Furosemide is a diuretic, diphenhydramine is an antihistamine, and prednisone is a corticosteroid for inflammatory conditions. 117. Which of the following medications should be used with caution in patients with renal impairment? A. Lisinopril. B. Furosemide. C. Digoxin. D. Ibuprofen. Answer: ibuprofen. Rational. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, that can worsen renal function. Lisinopril, furosemide, and digoxin may need adjustments, but are not as nephrotoxic as ibuprofen. 118. A nurse is educating a patient about taking an oral contraceptive. Which of the following instructions is essential? A. Take with food. B. Take at the same time each day. C. Avoid sunlight exposure. D. Take with a full glass of water. Answer: take at the same time each day. Rational. Oral contraceptives should be taken consistently at the same time each day to maintain effectiveness. Taking with food, avoiding sunlight, and drinking a full glass of water are not essential for effectiveness. 119. A nurse is caring for a patient taking lithium for bipolar disorder. What is a key sign of lithium toxicity? A. Excessive thirst. B. Dizziness. C. Rash. D. Bradycardia. Answer: excessive thirst. Rational. Excessive thirst, polydipsia, and increased urination are common signs of lithium toxicity. Dizziness, rash, and bradycardia are not primary indicators. 120. A patient is prescribed warfarin. Which of the following foods should the patient avoid? A. Dairy products. B. Leafy green vegetables. C. Citrus fruits. D. Tomatoes. Rational. Leafy green vegetables are high in vitamin K, which can interfere with the action of warfarin. Dairy, citrus fruits, and tomatoes do not significantly affect warfarin levels. 121. A nurse is caring for a patient with a peptic ulcer. Which medication is commonly prescribed for this condition? A. Omeprazole. B. Ciprofloxacin. C. Atenolol. D. Metoprolol. Answer: omeprazole. Rational. Omeprazole is a proton pump inhibitor used to treat peptic ulcers by reducing stomach acid. Ciprofloxacin is an antibiotic, and atenolol and metoprolol are beta blockers. 122. Which of the following is a common side effect of antihistamines? A. Sedation. B. Hyperactivity. C. Weight gain. D. Increased appetite. Answer: sedation. Rational. Antihistamines commonly cause sedation due to their central nervous system depressant effects. Hyperactivity, weight gain, and increased appetite are not common side effects. 123. Which of the following is the primary use of acetaminophen? A. Pain relief. B. Antibiotic therapy. C. Antihypertensive. D. Antifungal. Answer: pain relief. Rational. Acetaminophen is primarily used for pain relief and reducing fever. It is not an antibiotic, antihypertensive, or antifungal agent. 124. A nurse is caring for a patient receiving a thiazide diuretic. Which of the following electrolyte imbalances should the nurse monitor for? A. Hypokalemia. B. Hypercalcemia. C. Hyponatremia. D. Hyperglycemia. Answer: hypokalemia. Rational. Thiazide diuretics can cause hypokalemia, low potassium levels. Hypercalcemia, hyponatremia, and hyperglycemia are not as commonly associated with thiazide use. 125. A nurse is preparing to administer morphine for pain relief. Which of the following is the priority nursing assessment? A. Respiratory rate. B. Blood pressure. C. Heart rate. D. Blood glucose. Answer: respiratory rate. Rational. Morphine can cause respiratory depression, making it a priority to assess respiratory rate. Blood pressure, heart rate, and blood glucose should be monitored but are secondary. 126. A patient is receiving an ACE inhibitor. Which of the following should the nurse monitor for? A. Cough. B. Diarrhea. C. Weight loss. D. Increased thirst. Answer: cough. Rational: a persistent dry cough is a common side effect of ACE inhibitors. Diarrhea, weight loss, and increased thirst are not typical side effects. 127. Which of the following medications is used for the treatment of tuberculosis? A. Rifampin. B. Amoxicillin. C. Lorazepam. D. Metformin. Answer: rifampin. Rational: rifampin is an antibiotic used to treat tuberculosis. Amoxicillin is for bacterial infections, lorazepam is for anxiety, and metformin is for diabetes. 128. A patient with asthma is prescribed albuterol. Which of the following is a common side effect of this medication? A. Tremors. B. Nausea. C. Weight gain. D. Drowsiness. Answer: tremors. Rational: albuterol is a bronchodilator that can cause tremors due to its sympathetic effects. Nausea, weight gain, and drowsiness are not common side effects. 129. A nurse is caring for a patient receiving heparin therapy. What is the most important lab value to monitor? A. Activated partial thromboplastin time, APTT. B. Platelet count. C. Prothrombin time, PTD. International Normalized Ratio, INR. Answer: activated partial thromboplastin time, APTT. Rational: heparin therapy requires monitoring APTT to assess the effectiveness of anticoagulation. Platelet count, PT, and INR are monitored for other medications, but are not primary for heparin. 130. A patient is prescribed a proton pump inhibitor, PPI, for gastroesophageal reflux disease, GERD. Which of the following is a common side effect? A. Headache. B. Constipation. C. Hypotension. D. Dizziness. Answer: headache. Rational: headache is a common side effect of PPIs. Constipation, hypotension, and dizziness are less commonly associated with PPI use. 131. A nurse is caring for a patient receiving insulin therapy. What is the primary purpose of insulin? A. Lower blood glucose levels. B. Increase blood pressure. C. Stimulate digestion. D. Relieve pain. Answer: lower blood glucose levels. Rational: insulin lowers blood glucose levels by facilitating cellular glucose uptake. It does not affect blood pressure, digestion, or pain relief. 132. A patient is prescribed ciprofloxacin for a bacterial infection. What is an important instruction for the nurse to provide? A. Take with a full glass of water. B. Take with milk. C. Avoid sunlight exposure. D. Drink alcohol in moderation. Answer: take with a full glass of water. Rational: ciprofloxacin should be taken with a full glass of water to prevent crystal formation in the kidneys. It should not be taken with milk or alcohol and does not require sunlight avoidance. 133. A patient with diabetes is prescribed metformin. Which of the following is the primary action of metformin? A. Increase insulin production. B. Decrease insulin resistance. C. Increase blood glucose. D. Promote glucose excretion. Answer: decrease insulin resistance. Rational: metformin works primarily by decreasing insulin resistance, allowing the body to use insulin more effectively. It does not increase insulin production or blood glucose. 134. A nurse is preparing to administer digoxin. Which of the following must be monitored before administration? A. Heart rate. B. Blood glucose. C. Blood pressure. D. Respiratory rate. Answer: heart rate. Rational: digoxin affects heart rate and can cause bradycardia. It is essential to monitor heart rate before administration. Blood glucose, blood pressure, and respiratory rate are secondary concerns. 135. A patient with asthma is prescribed a corticosteroid inhaler. What is the primary goal of this medication? A. Reduce airway inflammation. B. Open airways immediately. C. Prevent infection. D. Stimulate mucus production. Answer: reduce airway inflammation. Rational: corticosteroid inhalers are used to reduce inflammation in the airways, improving asthma control over time. They do not open airways immediately or prevent infection. 136. A nurse is administering an antibiotic to a patient with a urinary tract infection, UTI. Which of the following is most important to monitor? A. Kidney function. B. Liver function. C. blood pressure D, respiratory rate answer, kidney function. Rational. Antibiotics, especially those cleared by the kidneys, can affect kidney function. Monitoring kidney function ensures safe drug use and prevents nephrotoxicity. 137. A nurse is caring for a patient prescribed an opioid for pain management. Which of the following is a common side effect of opioids? A. Diarrhea. B. Constipation. C. Insomnia. D. Nausea. Answer. Constipation. Rational. Opioids commonly cause constipation due to their effect on gastrointestinal motility. Diarrhea, insomnia, and nausea are less common but may occur in some patients. 138. A patient is prescribed warfarin. Which of the following should be monitored regularly? A. Prothrombin time, PT. B. White blood cell count. C. Blood glucose. D. Serum sodium levels. Answer. Prothrombin time, PT. Rational. Warfarin therapy requires monitoring PT or INR to ensure proper anticoagulation. White blood cell count, blood glucose, and serum sodium are not directly impacted by warfarin. 139. A patient with hypertension is prescribed a beta blocker. What is the most common effect of beta blockers? A. Increase heart rate. B. Lower blood pressure. C. Increase blood glucose. D. Cause sedation. Answer. Lower blood pressure. Rational. Beta blockers lower blood pressure by blocking beta-adrenergic receptors, which reduces heart rate and workload on the heart. They do not commonly cause sedation, increase heart rate, or increase blood glucose. 140. Which of the following is a potential side effect of taking nonsteroidal anti-inflammatory drugs, NSAIDs? A. Hypotension. B. Hyperkalemia. C. Gastric ulcer. D. Bradycardia. Answer. Gastric ulcer. Rational. NSAIDs can cause gastric ulcers due to their effect on the stomach lining. Hypotension, hyperkalemia, and bradycardia are less commonly associated with NSAID use. 141. A nurse is educating a patient who is starting treatment with an angiotensin-converting enzyme, ACE, inhibitor. Which of the following is an expected side effect of ACE inhibitors? A. Dry cough. B. Diarrhea. C. Weight loss. D. Increased appetite. Answer. Dry cough. Rational. A dry cough is a common side effect of ACE inhibitors due to increased bradykinin levels. Diarrhea, weight loss, and increased appetite are not typical side effects. 142. A nurse is caring for a patient prescribed a selective serotonin reuptake inhibitor, SSRI. Which of the following is a common side effect? A. Hypotension. B. Drowsiness. C. Sexual dysfunction. D. Weight loss. Answer. Sexual dysfunction. Rational. Sexual dysfunction is a common side effect of SSRIs, affecting libido and sexual performance. Hypotension, drowsiness, and weight loss are not as common with SSRIs. 143. A patient with chronic obstructive pulmonary disease, COPD, is prescribed a bronchodilator. What is the primary action of bronchodilators? A. Reduce inflammation. B. Relax airways, smooth muscle. C. Increase respiratory rate. D. Decrease lung secretions. Answer. Relax airways, smooth muscle. Rational. Bronchodilators relax the smooth muscle of the airways, making it easier to breathe. They do not primarily reduce inflammation, increase respiratory rate, or decrease lung secretions. 144. A nurse is caring for a patient receiving an antihypertensive medication. What is the primary goal of antihypertensive therapy? A. Increase blood pressure. B. Reduce blood pressure. C. Increase heart rate. D. Relieve pain. Answer. Reduce blood pressure. Rational. The primary goal of antihypertensive medications is to lower blood pressure and reduce the risk of cardiovascular events. Increasing blood pressure, heart rate, or relieving pain is not the primary goal. 145. A patient is prescribed an inhaled beta agonist. What is the expected effect of this medication? A. Bronchodilation. B. Sedation. C. Weight loss. D. Decreased heart rate. Answer. Bronchodilation. Rational. Beta agonists stimulate beta receptors in the lungs, leading to bronchodilation. They do not typically cause sedation, weight loss, or decreased heart rate. 146. A nurse is preparing to administer an antacid to a patient. Which of the following is an example of an antacid? A. Ranitidine. B. Omeprazole. C. Aluminum hydroxide. D. Diphenhydramine. Answer: aluminum hydroxide. Rational. Aluminum hydroxide is an antacid used to neutralize stomach acid. Ranitidine and omeprazole are H2 blockers and proton pump inhibitors, respectively, and diphenhydramine is an antihistamine. 147. A patient is prescribed a benzodiazepine for anxiety. Which of the following is the most important assessment before administering this medication? A. Respiratory rate. B. Blood pressure. C. Temperature. D. Heart rate. Answer: respiratory rate. Rational. Benzodiazepines can cause respiratory depression, so assessing the patient's respiratory rate is essential before administration. Blood pressure, temperature, and heart rate are important, but secondary considerations. 148. A nurse is caring for a patient receiving an opioid analgesic. Which of the following should the nurse monitor for? A. Tachycardia. B. Hypotension. C. Respiratory depression. D. Increased appetite. Answer: respiratory depression. Rational. Opioids can cause respiratory depression, which can be life-threatening. Tachycardia, hypotension, and increased appetite are not primary concerns with opioid use. 149. A patient is prescribed warfarin and is advised to avoid foods high in vitamin K. Why should the patient avoid these foods? A. They can interfere with blood clotting. B. They can cause hypertension. C. They can increase potassium levels. D. They can cause a rash. Answer: they can interfere with blood clotting. Rational. Vitamin K can interfere with the anticoagulant effect of warfarin, reducing its effectiveness in preventing blood clots. It does not cause hypertension, increase potassium, or cause a rash. 150. A nurse is caring for a patient receiving a loop diuretic. Which of the following is a potential side effect of loop diuretics? A. Hypokalemia. B. Hypercalcemia. C. Hypertension. D. Increased appetite. Answer: hypokalemia. Rational. Loop diuretics can cause hypokalemia, low potassium levels, due to increased potassium excretion. Hypercalcemia, hypertension, and increased appetite are not typical side effects.